Hi, everyone. My name is Brett Weber, and I'm a Public Health Policy and Programs Manager with the National Indian Health Board. Thank you all so much for joining us for this webinar on centering tribal community voice within tobacco strategic policy development. We're really interested to bring you some subject matter experts on this topic and really hoping to engage in a good conversation today. Just a couple of housekeeping notes before we get started. And I think everyone should be pretty much old hat at this by now, but we have everyone muted if you just to reduce background noise. If you do want to unmute, you can use the raise your hand function, or you can put your questions or comments in the chat box. This webinar is being recorded and will be posted on NIHB's website in the near future. And then lastly, if at the end of this webinar, if you could please take 2 minutes out of your day to fill out an evaluation, that would be really helpful for us, just to give us a little bit of feedback on how useful this information is to you and how what other topics would be helpful to you. So I'm going to go ahead and post the link to the evaluation right now. And you can fill that out at the end of the webinar, and I'll give you a reminder about that. But I've done enough talking, so I'm going to turn it over to Tia Benally to talk about this interesting topic. Go ahead.
Sure. Ray, can you start the... Great. Okay, welcome everyone. Like Brett said, we're excited to have you here with us. We're going to be talking about the 2021 Centering Tribal Community Voices within Strategic Policy Development. This is a project that's supported by the New Mexico Department of Health Tobacco Use Prevention and Control Program. So before we dive into any content stuff, I'd like to begin by introducing our team, beginning with myself from the left. My name is Tia Benally. I'm Navajo and White Mountain Apache, originally from New Mexico. I'm a current project coordinator with Keres Community Health and the Smoke-Free Signals Project. Next, we have Josiah Concho, who's Acoma and Navajo, also from New Mexico, and also a project coordinator with our organization. Our other team members include Anthony Saavedra and Ray Charlie, as well as our project manager, Leslie Meyer. We're really excited to be here with you all today, and please feel free to utilize the chat for any questions, and we'll make sure to get to them at the end. Now, for those of you who are not familiar with our program, we'll briefly introduce our project. We are the Smoke-Free Signals program. Smoke-Free Signals provides commercial tobacco prevention and awareness in New Mexico, specifically serving Native American communities such as Pueblos, nations, and tribes. Collectively, we advocate for smoke-free environments and policies and spaces that serve priority populations such as youth and the elders. In addition, our program partners with various organizations and tribes by providing presentations, trainings, technical assistance, and funding in form of mini grants, which I will dive into a little bit later. To stay connected with us or to learn more, please like our Facebook, which contains our website, helpful toolkits, previous newsletters, and other guides for your reference. So I've linked in the chat our website if you are curious to check us out. And now to go over our website briefly, as I mentioned, we do have a bi-weekly Smoke-Free Signals newsletter. Josiah puts together great content, not only for New Mexicans, but also we have national resources in there as well. And if you're like poking around in there, you'll find out that the Smoke-Free Signals has different categories. We collaborate with different organizations and provide resources, including those for tribal schools, tribal policies, tribal enterprises, community health, also topics in specific to like homes and cars, multi-unit housing, community spaces, and e-cigarettes, which is a hot topic, which also we'll look into later on. But like I mentioned, if you have any more questions or you're just interested in see what we're about, please click on that link in the chat. And these are just brief screenshots for you to see what you'll be expecting if you decide to check us out. So as mentioned previously, we collaborate and partner with various Pueblos, nations, and tribes throughout the state of New Mexico. And for those who are not familiar with the state, here's a map of different communities we've served in the past. So pre-COVID, we were able to travel for health fairs, trainings, conferences, and provided presentations to all these various pueblos, as you can see pictured on this map. Specifically, we've worked with the Pueblo of Hayes on numerous occasions, including a youth diabetes prevention project that we were able to include back in 2019. So as you can see, we highly value our tribal partnerships and networking in our state. So for this slide, we wanted to go over some learning objectives. Collectively as a team, we came up with these and we hope that we're able to hit each of them for this webinar. So beginning with understand the history associated with policy, specifically in tribal communities, followed by identifying types of commercial tobacco products and associated harms and risks. Next, we have recognize the health effects of secondhand and third-hand smoke and secondhand aerosol. Then we have understand types of existing health policies and advocacy at a grassroots level. And then finally, establish confidence in creating strategic policy development for your community.
All right, thank you, T. So before we begin our strategic policy development presentation, I would like to start off with a few acknowledgements. Before we start discussing policy, our program would like to address and recognize the impact of historical trauma within Native American communities. For some of you, the concept of historical trauma may be a refresher to what you already know, or maybe something you knew little about. The Substance Abuse and Mental Health Services Administration describes historical trauma as the cumulative, multi-generational, collective experience of emotional and psychological injury in communities and descendants. The SAMHSA also notes historical trauma greatly impacts Native communities due to colonization, assimilation policies, and general loss. As a result, many tribal communities do have a mistrust of outsiders and the government. However, for the purpose of this presentation, the Smoke-Free Signals program uses the term health policy to represent plans, strategies, and principle. But before we dive in deeper into the presentation, let's take a step back to look at the whole picture of what health policy is. Specifically, health policy is defined by the World Health Organization as decisions, plans, and actions that are undertaken to achieve specific healthcare goals within a society, which can be broken down into specific policies. A variety of these health policies exist at the national and state levels. And another reason why health policy is so important is because of its effect on future decisions and prevention efforts, which is why we encourage communities to engage in policy efforts that are culturally appropriate and encourage overall wellness in the community, such as protection from the harms of secondhand smoke and aerosol. As well, we acknowledge the traditional and beneficial use of tobacco within tribal communities and recognize its place of honor and respect within those communities. The Smoke-Free Signals program strives to reduce and prevent commercial tobacco, secondhand smoke exposure within New Mexico tribal communities.
Great, thanks, Josiah. I'm going to lead us through a brief overview. I'm sure most of us are already highly knowledgeable with this information, but we're going to go ahead and just briefly touch on them. So for this slide, we have commercial tobacco products, which, as you know, come in an array of packages and forms. To the top left, we have the typical combustible cigarette, followed by cigars, smokeless tobacco such as chew and dip, and other electronic devices in forms of e-cigarettes and e-hookahs. Specifically, these are the newer products, which are the electronic nicotine delivery system. So they were introduced to the commercial tobacco market back in the early 2000s and can be found in an array of sizes and shapes, such as you could see like there's e-cigars, e-pipes. We have the large size, which are tank sizes, also referred to as mods, followed by a little bit more popular one, which are the pen-like devices known as vape pens, and other rechargeable e-cigarettes like Juuls. And finally, the disposable e-cigarette, which is also known as puff bars, which have become actually increasingly very popular. For example, due to the puff bars' appealing flavors such as orange, mango, and guava, it makes it more appealing to youth. And according to the Truth Initiative website, due to the loophole in policy, which took effect in January, which restricts flavors for closed system e-liquid cartridges like Juul and its pods, it's essentially paved the way for the surge in Puff Bar's popularity.
Okay, now that we have differentiated between the types of commercial tobacco products available, let's look at the potential health risk associated with the use. First, as you may already know, smokers do have an increased risk for developing heart disease, stroke, and lung cancer. The Center for Disease Control and Prevention states smoking increases your risk for stroke 2 to 4 times, as well as coronary heart disease. Also, those who smoke less than 5 cigarettes a day are also at increased risk for cardiovascular disease. Specifically, smoking can cause lung cancer by damaging airways and developing breathing issues. And finally, smoking harms nearly every organ in the body, such as bone health, teeth, gums, and vision. It can cause cancer almost anywhere in the body, in the lungs, kidney, pancreas, liver, bladder, colon, and stomach. Due to e-cigarettes being a new topic in the evolution of research, the items listed on the slide are potential effects. The CDC states e-cigarettes are not safe for youth, young adults, pregnant adults, or for those who do not currently use commercial tobacco products. Back in August 2019, the CDC recognized EVALI, which stands for e-cigarette or vaping product use associated lung injury. EVALI is a lung condition that causes shortness of breath, cough, chest pains, and other symptoms. One of the key ingredients in e-cigarettes is nicotine. This substance is highly addictive and can cause harm to developing fetuses, adolescents, teens, and young adults in their early to mid-20s. In a recent study done by the CDC found that 99% of the e-cigarettes sold in the US contain nicotine. E-cigarettes can also can cause unintended injuries. These are in forms of defective battery catching fire or exploding, or nicotine poisoning caused from the swallowing or breathing of or absorbing e-cigarette liquid through the skin or eyes. The health effects of smokeless tobacco includes users potentially developing cancer of the mouth, esophagus, and or pancreas. The Food and Drug Administration also stated that there is a linkage to about 30 chemicals that can cause cancer. Okay, now that we have briefly discussed health effects of commercial tobacco use, let's shift some gears to secondhand smoke. Secondhand smoke is also known as environmental tobacco smoke. Secondhand smoke is a mix of 2 forms of smoke that comes from the burning tobacco. First, the mainstream smoke is a type of smoke exhaled by the smoker. And secondly, the side stream smoke comes from the lit end of a cigarette, pipe, or cigar. Secondhand smoke also contains cancer-causing chemicals, toxic metals, and poisonous gases. The exposure to secondhand smoke can cause cancer, damage to the brain and kidneys, and also affect respiratory functions. Also, something else to note is that secondhand smoke is inclusive of secondhand aerosol emitted from e-cigarettes as well. Whether you have encountered any of the misconceptions, such as it's harmless water vapor, or because e-cigarettes give off a fruity smell, it may mean they are not dangerous, but all are false. In fact, the vapor, or correct term, secondhand aerosol, can contain harmful and potentially cancer-causing substances. The aerosol emitted often includes nicotine, ultrafine particles that can go deep into the lungs, and heavy metals such as nickel, tin, and lead. Particularly, the aerosol's fruity fragrance contains diacetyl, which is a chemical linked to a serious lung disease. When we talk about secondhand smoke protection and policy, this includes secondhand aerosol as well. Moving on to third hand smoke, this might be a term you're not familiar with. Specifically, this was new to me when I first started working in commercial tobacco prevention. The American Indian Non-Smokers' Rights Foundation describes third hand smoke as the residue contamination from tobacco smoke that lingers in rooms long after smoking stops. This is commonly known as the smell that lingers on your clothes after leaving a smoky place. Also, the sticky substance left behind from third-hand smoke often contains highly toxic particles like nicotine. Children of smokers are at higher risk of third-hand smoke exposure due to their living environment. Because third-hand smoke clings to the inside of homes, hair, clothes, pets, and cars if you have a significant level of contamination. Also, young children are more likely to ingest tobacco residue by putting it on their hands and their items in their mouth after touching different surfaces.
Great. Now that we've understand like what secondhand smoke, thirdhand smoke, and secondhand aerosol might look like, we're going to move into why smoke-free environments matter. There's many health benefits of quitting smoking, but there's also financial benefits, just to include that as well. So looking at benefits, we can start with everything from improved air quality. So for this, it also improves the health status due to the reduction of secondhand smoke exposure and smoking. The implementation of laws and policies that protect communities include protecting all workers and patrons from the dangers of secondhand smoke, reducing death and diseases associated with secondhand smoke may encourage others to quit smoking. This is also inclusive of secondhand aerosol and thirdhand smoke, like we mentioned earlier. Specifically in New Mexico, we just wanted to go over what we have in regards to existing policies. So currently in the state of New Mexico, we have the D. Johnson Clean Indoor Act, which prohibits smoking in indoor spaces such as restaurants, hotels, motels, and bars. Back in 2019, the act was expanded actually to prohibit e-cigarettes as well, everywhere smoking is not allowed. Continuing, the policy also requires 90% of increase of smoke-free and vape-free hotel and motel rooms and smoke-free childcare facilities.
So now that we have a good understanding of what health policy is, let's focus now on what policy might look like in your community. When thinking of policy in your own home or personally, it might seem like a silly thought, but because often policy is thought of as this big movement that affects health, such as the Affordable Care Act or the Clean Indoor Air Act. However, by going about policy development in a grassroots manner, it puts into perspective how much influence we have for the health of our family and community as a whole. Okay, so starting with the individual level, we can look at this as making rules for yourself, like choosing not to eat takeout during the week, and instead prepping healthy meals for the week. Secondly, we have family. An example of this could be not allowing visitors to smoke in your home or car for the protection of your family. Thirdly, we have community. An example of this could be ensuring all events that occur in your tribal community are smoke-free. Pre-COVID, this might have been celebratory festivals, feasts, and other cultural events. And finally, as for an organization, this could be smoke-free and vape-free spaces at work or school and or designated smoking spot that is far enough safe distance from the organization's building.
So in regards to what Josiah had just shared about policy, we welcome you all to use the Q&A, even though it's questions, we're breaking the Zoom rules. If you can include what types of policies you currently have, starting from the individual, family, community, organization, please feel free to share in there. If you're tuning in from somewhere other than New Mexico, do you all have something similar to the D. Johnson Clean Indoor Act? We would love to know more, so if you could just include that, that'd be great. So in regards to reclaiming policy, as we continue to look at policy in a variety of contexts, let's now shift our focus to how we can reclaim policy by creating one that is culturally appropriate, promotes health and wellness, and most importantly, protects our community and loved ones. This is most importantly because, as Josiah mentioned earlier, there's a lot of negative stigma, especially in Native communities around policy. So we want to be as inclusive and center the community's voices as much as possible, and how we're able to do so is by reclaiming policy. So something that we use here with the Smoke-Free Signals program is something that we created, which is the INSPIRE model. And really the INSPIRE acronym is just to help us get started on a policy development or advocacy. Also note that what we're about to share is very brief overview. So if you have additional experience in advocacy or even lobbying, then this might become as a refresher, but also it's a good start to get a community going, because policy can be intimidating, especially with all the jargon. So we try to make this as inclusive as possible, which is the reason why we have this model. So starting with the I, we have information, which is educate yourself as much as possible through reliable literature sources or state policies. So this would basically be like the research process. So really, using Google or using your partnership and figuring out, what kind of policies are currently implemented. So in Navigate, make a plan that includes next steps or possible milestones needed to achieve your goals. This might oftentimes be the hardest part because, it's like where to start. It's like with a paper, like I just need to get that one sentence down and then it'll be smooth. Same thing with Navigate. And of course, this is continuous, so you'll be able to adjust your plan accordingly. Such as COVID-19, which has taught most of us that our plans do not go accordingly. So, adjustment and flexibility is important. Strategy, determine your population and define your policy. So for us, because we're not a tribal serving organization, we're inclusive of all tribes. We would have to pick our specific population. For example, I had mentioned we worked with the Pueblo of Hayes in the past. So we were able to partner with them and get the support from tribal leadership. But if you're coming from a specific tribal community, then you do have that defined population, and maybe even go a little bit further and figure out if you want to work with priority populations such as the youth or elders, and also tailoring your policy around to fit that. And then we have purpose, which is create a clear ideal outcome for your designated goals. It might seem like P is kind of very similar to N, but really it's just like becoming more concrete, defining your goals a little bit more, maybe being a little bit more thoughtful about them. Navigate and purpose, they can definitely build on each other. And of course, they can always change. And we have improvements, which is establish a vision or action items for moving forward for the adaptation of your policy. So as I said, flexibility is important. Oftentimes we have an idea and I know I get so stuck on it and I'm like, no, this is my vision and this is where I want to go. But maybe you get the input of community members, really including them in your policy, what might work for them, what might be more successful. So this is always continuous. And of course, we try to look for that every year in evaluation. Reward, celebrate the wins, no matter how big or small. So this one specifically for you all. Like I said, like this year has been so challenging for everyone, mentally, physically, emotionally. I'm a people person, so I, of course, would love to give this in person to you all and like to network, but also, think about yourself because policy can become grueling, it can become tedious. But just remember, any big is, any win is small or big is worth celebrating, and that could include, with your team, if you do have a team like us, if it's yourself, however, self-care, you want to take care of yourself, we definitely emphasize that because oftentimes we forget about that. We just kind of go and forget that, oh, maybe I should drink some water, I should breathe, hang out with family, stuff like that. And encourage, involve your network of family members, friends, peers, and colleagues. Like we said, this is truly for the community. So as much input as you can get as possible because they are the experts. Of course, we are the professionals coming in with all our methods and tactics, but really the community knows what's going to work for them and what's not going to work for them. So just try to keep that in mind, especially when thinking about how this model can fit to you. And of course, the Inspire model, you want to tailor it as much as possible to your community. So really the emphasis on that will make policy development a little bit more smooth and then also more successful. And you can also think of it as like SMART goals, which we're all familiar with. So this can definitely help with that. So this part, we're going to go into the community leadership program. Josiah and I are going to tag team on this because Josiah is a little bit more newer to the program. So I've been with the program a little bit longer. So this was our time actually to shine for our program because really, like we said, what makes us more successful is the community. And so we want to highlight them specifically in this presentation. So I'm going to set it up what the CHLP program is. So as an organization, how we have reclaimed policy is providing resources and technical support to those passionate about making a difference in their community through commercial tobacco intervention and prevention methods. Specifically, we established this community health leadership program, which provides mini grants, as I mentioned earlier, to various tribal communities. The purpose of this funding is to support individuals. And this year we actually included organizations because previously it was only individuals, but because of COVID, we thought that we could open it up, especially, low resources and the need for this type of prevention and intervention work. But also those who are able to get this mini grant, they're able to, make a real change in their community. And then also examples of collaboration with selected community health leaders include, in the past, we've helped with designing and implementing a policy action plan tailored to their community or organization. As mentioned earlier, the Inspire model, we use that, just to have a conversation because, like I said, like policy can be a little bit intimidating. And so, just having a sounding board or professionals to help lead them through this process, that's what we were really able to do. Additionally, the advocacy goal is focused on secondhand smoke, secondhand aerosol, and commercial tobacco prevention. So we ask community health leaders, prior to submitting their application, that they do think about these areas of prevention and intervention in their communities. And it's truly inspiring to see all the ideas that come out of this because the application can only go into so much depth, but once you put a face to the application and really talk about their plan, you can see how passionate and motivated they are to help their community members and how these mini grants allow them to do so. So for this next portion, we're going to just briefly highlight some community health leader champions to give you an idea what a CHLP might look like. Also note that this begins in we usually start in the summer or the fall of the program, and they have about 6 months, six to 7 months, depending how ready they are to start the program. And then they're able to use those months to spend their mini grant. And of course, they're connected constantly with the Smoke-Free Signals team to provide any technical support. Of course, more so this year because of COVID-19, but we do like monthly check-in calls. We're constantly there for them. We're their cheerleaders. If something doesn't go accordingly, of course, to plan, then definitely we're there to help them make adjustments and just provide additional support and of course reward them for all the hard work that they put into it.
For one of our first community health leader champion is Rachel Riley. She's from the Pueblo of Hayes. She continued to assist her community by ensuring events in the community were smoke and vape free, and she was able to raise awareness to others about the importance of understanding the dangers and risk of commercial tobacco. One statement that she did share with us is, I think one of the biggest things that I have learned while being a community health leader is how to adapt. This year, 2020, I think has thrown us all for a loop, and it was a unique challenge figuring out how to deliver information during this time. It has been a great learning experience.
Yeah, so for Rachel, Rachel actually came on right when, so it was pre-COVID, but also then it did transfer into when we did go into lockdown. But before that, she was able to do community outreach. She was from the Pueblo of Hayes, so they did things such as like the Great American Smokeout, as we all know, is in November. So she hosted an event there. And then also at these mini health fairs, she was able to set up a table. And of course, we know how expensive supplies can get. And so what we were able to provide Rachel with was educational materials and any sort of like swag items, because as you know, community members, definitely love the free stuff. And so anything that we could help her get started, we were able to provide that support. And then what I mean in regards to like educational materials, we were able to, go to different stores in Albuquerque, which is where we are located, and we're able to get these professionally printed. So that way she was able to provide them to her community.
Our second community health leader champion is Anthony Romero. He's from the Pueblo of Hayes. This past year and the years before, he did an extraordinary job by involving key stakeholders in the topic about policy and commercial tobacco prevention. He did this by facilitating and collaborating with the Pueblo of Hayes governors, healthcare professionals in our program. And a little statement that Anthony shared with us too, that I have learned that there are so many people who are compassionate about the health and well-being of others in our families and community. And he also shared his appreciation too for the Smoke-Free Signals team as well, that were able to join him in a tribal council meeting within the tribal community, and also being part of the presentation to the children there in Hayes too as well. And definitely one thing to note too, that Anthony is proud that it's definitely something that Hayes will always remember, that it's an experience too.
Yeah, so as Josiah mentioned, Anthony is one of our most frequent and passionate, hardworking CHL. He's done the program for 2 years in a row. And as mentioned earlier, the first year was really like getting like ground softening with tribal leadership. And, just something to note about that is it's very hard to get a working meeting or any sort of like Facetime with tribal leadership. And so for him to really make that big milestone achievement was amazing. Myself and the other Smoke-Free Signals team, we thought we're gonna only meet for 30 minutes, the governor's busy, but we ended up meeting for like an hour and a half because they were just so great. They were so passionate about the program. And a little story Anthony had shared with me is that during cultural festivities, again, he was talking to the governor, and the governor was just like constantly praising the Smoke-Free Signals program, but also like all the work Anthony has put into it, because it is hard. He's from a rural community. There's certain barriers associated with like low access to internet, also transportation, and he is a full-time dad. So, juggling all of that, it was just like phenomenal how much work he had put into it. And then recently this year, he shifted his focus because he was like, hey, T, it's COVID. I don't know what to do. All I know is I want to continue to keep helping my community. But if you could, if you and the Smoke-Free Signals team could help me adjust this virtually. And, definitely he took on that challenge and he did amazing. Here pictured are some children that he presented to. So the unique thing, as we know about COVID, is that we've been able to do things virtually. So actually our work has been able to stretch across several states, because these children are not only from the Pueblo of Hayes, but they also span over into Arizona where they're residing. And so with this, he was able to present to them about the dangers of secondhand smoke, thirdhand smoke, secondhand aerosol, and then also have a conversation with parents about what e-cigarettes are, because we're experts in it. We do all the research on it, but parents are like, I don't know what my kids are doing. And so for him to provide that friendly face and then also educate them some more, what our program specifically were able to do were to send them these items, these swag items, and it includes like notebooks, folders, school supplies, because those are very important, and they all seem to really appreciate it. And then other things we're able to provide to them are like gift cards, and then, just to keep them motivated to learn more about the dangers of commercial tobacco.
Okay, so our third group of community health leader are the group from the Pueblo of Hayes. This includes Diane Shahey, Judith Gachupin, and Vernon Says. They all represent the Pueblo of Zia. Their dynamic and phenomenal work for the community translated to ensuring signage on all the tribal buildings and playgrounds. Their signs listed no smoking within 30 feet, which actually goes beyond the state recommendation of 25 feet. And of course, they showed their appreciation for the staff and the understanding to willingly work during the COVID-19 pandemic.
So this group is definitely the dynamic trio. I got the pleasure of working with them, as mentioned, not only in tobacco work, but also other areas such as youth diabetes prevention program. And they're just very passionate about their community. For this, we were able to customize their signs with their tribal logo on it. And then also, as mentioned earlier, we were able to extend the feat of smoking. These were placed on tribal buildings, but also like where the areas where kids play, childcare facilities, and then also have a clinic there. So they're able to post it at the clinic. And they're just, again, very motivated and, strong will to help get others informed. And so I've always had a great time working with these three.
Another one of our community health leader was Kevin Begaye. He's from the Navajo Nation Tahatsul Council of Natani chapter. His commitment and care for community translated to him educating community members about the harms of commercial tobacco and ensuring that the chapter house had appropriate policy signage that indicated the building environment and in the environment was smoke-free. And one thing he did share with his community was the knowledge that third-hand smoke can stay on items in the home, such as furniture and children's toys, and maybe be harmful to our younger people. So Kevin was able to share that with us.
So as you can see, pictured is our CHL Kevin. Just to point out, this is his mentor and supervisor, who is also the Navajo Nation Council delegate, Amber Kanazba Crody. They both worked on this project, to tailor it for their community. So really it was a combined effort, but something that really stood out when, talking to Kevin at the end of the program was that he would go to the chapter house and he would actually, sit there with the elders and talk about commercial tobacco and traditional tobacco. And so in the beginning, as you notice, we had said everything that we're referring to is commercial tobacco, not traditional. And actually he had several conversations around that because many elders were like, yeah, I use tobacco, but really diving into their stories, it's like, oh, okay, you're using traditional tobacco for cultural practices and stories. And so, really understanding and deciphering helping them decipher the difference between the two was essential to this project. Kevin did travel very far to come and see us. So if you're familiar, like where his chapter is at, it's I want to say it's like 3 hours west of Albuquerque. And so traveling all that way, for our meetings, and then also, just really seeking out this mini grant just shows how determined and resilient he was just to help his chapter house. If you all are familiar, Navajo Nation is the largest tribal community among the
AT, you still there? Hello, T. T, are you still with us?
It looks like T had a little bit of technical issues, and I think she's going to try to re-log in.
Okay.
Josiah, are you able to continue, or should we?
Yeah, I can continue, yeah. Okay, so as T was saying about our community health champions this past year, we were able to work with them in different projects and different resources. We were able to provide resources, technical assistance to them. So it was definitely a great year. And of course, it was challenging under the COVID-19 pandemic, but this year was challenging, especially in the public health field, which I am sure we can all resonate with. Due to this, many tribal communities were disproportionately impacted and closed their communities to the public. As a result, many events, health fairs, and conferences were either canceled or postponed, including the pause on networking and collaboration with others. However, while we were all adjusting to working from home, it presented other challenges, including recognizing the need for commercial tobacco prevention and control more than ever. Collectively, as a team, we decided that the CHLP program needed to be implemented this year. From this, our resilient and determined CHLs, including the individual from the Pueblo of Hayes, which is one that we shared with earlier, was Anthony Romero, and the Native Health Initiative Organization. They were a multi-team, so we're able to collaborate with them and also provide technical assistance when they needed. Although our team was small this year, that did not affect the amount of change our CHLs were able to make in policy development. For example, one of the CHLs were able to educate the youth about commercial tobacco and ways to practice prevention. Again, his name was Anthony Romero. He was the one that was able to share education resources to his tribal community and youth within the Pueblo of Hayes. While another one was able to develop a policy action plan specifically for their organization, which will be posted on their future events, including indicating that their events, their programs are all smoke-free and vape-free event and will become vape-free events in the future. And also around their building, the facility, and the environment around there will all be included within this policy. So those are some of the challenges that the CHLP program ran into, and also the smoke-free signal. Of course, we all adjusted and everything did work out as well too. Might have been different from how the program was run a couple of years ago, but this year definitely didn't stop our CHLPs from making a difference within their community. But I know we're coming up towards our 15-minute questionnaire, but overall, there are many factors and considerations needed to address policy development, specifically in the commercial tobacco prevention field. However, by ensuring to engage key stakeholders, community members, and keep in mind the policy is culturally appropriate and equitable, the policy will continue to protect priority populations such as elders and children and provide a cleaner environment for everyone. But I just want to say thank you for watching our strategic policy development presentation. We hope this helps you to accomplish your goals and your visions for a healthy community. Please follow us on Facebook, on our Facebook page at Smoke Free Signals, or visit our website at smokefreesignals.com. Stay updated with our upcoming events, news, and education materials. As T showed you previous early in the presentation, we do have information that shares education resources to toolkits that communities can use, other public health representatives can also use. And then also we do have a bi-monthly newsletter too that we do share with tribal communities, different people who are interested in our secondhand smoke prevention. That's all available on our website too as well. And within this past pandemic, it's because of the whole restrictions in terms of in-person engagement. We do have an educational video series too as well that we're able to share. So every week we have shared a new video on different topics pertaining to secondhand prevention, secondhand smoke prevention, to thirdhand smoke, protecting pets at home, protecting your family at home, to all the way to COVID-19 impact in terms of when you're vaping during the pandemic. So we have different topics that people can use and utilize within their education series, or anything they could use within their tribal communities or their policy development too as well. But again, I want to say thank you for joining us today, and I hope we all learned something, and we appreciate you for watching.
Great, thank you so much. And T is still working on getting back online, but we have a few minutes left. So I think, are we good to open it up for questions now?
Yeah, definitely.
Great. So if you have a question, you can use the raise your hand function and we can unmute you. Or if you're not feeling necessarily talkative, you can put your question in the chat or the Q&A functions, and we can get you there.
I'm looking at the chat right now, and I can definitely see some comments like Karen earlier when T was presenting about the different laws around the United States that pertain to the ban or in terms of tobacco policy. We did get one from Sam Stevens from Alaska Family Services, and they mentioned that they do have a smoke-free workplace law, which is similar to the D. Johnson in New Mexico. And then also too as well, another one, from Maryland, has a ban on indoor smoking similar to New Mexico, but there's one for that. And then also too as well, but yeah, if you have any definite questions or any comments about the presentation or questions, please feel free to share. but definitely we are looking forward to what our program can do the following year and the upcoming years in terms of secondhand smoke prevention to tobacco policy too as well, and including e-cigarettes too. And I don't believe T will be joining us for the rest of the presentation. But if you have any questions, feel free to share.
Yeah, I have a question actually. While folks either formulate their thoughts or whatever, but so we've seen a few places in Indian country that have kind of used the COVID pandemic as a opportunity, if you will, to transition facilities, and that can be gaming facilities or any kind of building, to have smoke-free status. And they've kind of thought of it as sort of a temporary thing, as far as COVID being an airborne illness, and we want to make sure that the air is clean, and there's a lot of concerns around that. But what recommendations would you have, or what kind of best practices do you see around making that transition permanent and making sure that we don't necessarily try to return to a normal where smoking is prevalent in buildings? Do you have thoughts on that?
Yeah, for sure. Yes. Thank you for your question. Just based on how tribal communities function and operate, I think it does have a unique way of a passion to care about their people, their workers. So I think a lot of casinos, basically, I'm not pretty much around the area too as well here in New Mexico. A lot of tribal communities are still under the smoke. They're all smoke-free currently, but I think the future long run of it is definitely something that they are considering looking into in terms of just keeping it smoke-free and vape-free as much as possible. But in terms of protecting the health of everybody, I do understand that a lot of the tribal communities in the area too are slowly transitioning, trying to figure out new ways to protect their staff and employees, including daily users that come by, daily visitors. But
great, thank you. That's really helpful, and I think that's really definitely a kind of a hot topic in Indian country right now. A lot of tribes and facilities managers are looking at making that change one way or the other, and hopefully staying permanent. And we do have another question that just popped up in the chat that I can read aloud. How can tobacco prevention coordinators initiate partnerships with tribal councils?
Okay, so thanks for your question. Well, just based on our experience within the past, working with tribal community health departments and different leaders, just engaging them on different activities. For example, one of our projects is the community health leaders, so catalog community health leadership program. So we're able to work with tribes directly in terms of what they're advocating for. So going to either, for example, setting up a tribal council meeting, or even meeting with their community health departments or fields. We're able to communicate with them about their issues, their projects, what they would want for their tribal community. And by that, we're able to collaborate or even partnership in terms of providing these mini grants, for example, within our community health leadership program to support them on their initiatives, their future goals in terms of providing tobacco related policies to include an e-cigarette ban within schools or in these type of signage. So we did have provided signage for communities. We're able to provide funding to within these little mini grants for them to support aid in terms of education material to youth, to education material for adults, and also even to like seniors within the tribal community too as well. If they have like a community home or a senior facility or a senior home, where some groups will be able, communities would want to provide signage or even education, smoke-free signals will be able to support them in those different initiatives. So I think those are some ideas too as well. And I believe Leslie Meyer would want to share. She's our program manager with Keres Community Health.
Yeah, hi. I just wanted to join the conversation because T left, and echo what Josiah said, and also add that in order to effectively initiate partnerships with tribal council, something we found really helpful is Facetime, which is difficult, of course, currently, but the Smoke-Free Signals program began in 2015, and we had members from our team going statewide, attending health fairs, offering presentations, delivering education in schools. And so it's that repeated face-to-face relationship where you make relationships with the community health representatives or health directors or just everyday community members. And then you're able to see that once they see you as a constant presence in the community, you're there to help and offer your services, then you're more likely to be able to get that audience of tribal council as you seek their support for smoke-free policies. So you got to be in it for the long game.
Is there any other questions that anybody may have?
In the
I
meantime,
don't see any in the chat, and I don't see any hands raised. So Leslie or Josiah, is there anything you would want to say in closing?
just real quick, Brett, I want to talk a tiny bit about the smoke-free casinos and your question about maintaining the new normal, hopefully, of smoke-free enterprises. I can speak to New Mexico specifically. I know we have a few coalitions in the state, programs like Smoke-Free Signals, who are offering free support and resources, like offering to buy the casinos free signs to share about new smoke-free policies, helping them draft policies. And then there's organizations on a national scale that have free support to Americans for Non-Smokers' Rights is a great one. So I think the key there is identifying, speaking to the correct person, and then helping them navigate the wealth of information and resources that are out there, because I think as public health advocates, we all want to see smoke-free spaces be the norm. We want to make that accessible to everyone. We want to eliminate any financial barriers or red tape that's there. So it's again getting the right audience and making them aware of the services that are out there.
Absolutely. Thank you so much, Leslie. Really appreciate that. So I guess since we don't have any other questions, I think we can, Sam has his hand raised. So let me, actually, could Casey, can you unmute Sam, please? Since I'm not the host.
Hi, this is Sam Stevens. I'm the Tobacco Prevention and Control Program Coordinator with Alaska Family Services. I had a question. What is an alternate strategy to trying to meet or with like a tribal health director? So I have tried calling the tribal health director directly. I've also tried sending them an email. And I know because of the pandemic, maybe tobacco prevention isn't on their foremost primary like list of topics to address at this moment. And I understand that. But I was just seeking to know if there's another avenue that I can try to possibly, get them to meet up with me, either via Zoom or in person at least. I don't know if I need to like write a letter to them, or if I should just continue to just be patient and wait. Yeah.
I think it's a great question. As tribal leaders are dealing with, supporting their communities amidst COVID-19, sometimes tobacco control takes a back seat, understandably. And what we've done at Smoke-Free Signals, just like you, we make phone calls and emails. We also send hard copy letters, and new this year we've started faxing also. So we're hitting all the means of communication, and after that, I think, like you said, it would be patiently waiting or not so patiently waiting, and then offering those follow-up emails, phone calls, Hi, it's Leslie. I'm checking in that you received my letter on June 16th, and I'm here whenever you're ready to meet. It's difficult. It is.
All right, thank you.
Thank you for that question. And just as we wrap up, just again, if you could please fill out the evaluation for this webinar. I just put the link in the chat again. And I don't see any other attendees with their hands raised, and I don't see any other questions in the chat. So I think we can go ahead and wrap up there. So please join me in thanking Josiah, T, and Leslie for this wonderful presentation. And it's given me a lot to think about. I hope it's given you a lot to think about as well in moving forward in this space. We will follow up with more information for attendees within the next day or so, and look for this webinar to be posted on NIHB's website as well. So thank you all so much for joining us, and we're wrapping up about 5 minutes early. So thank you all for your time, and I hope you have a good rest of your day.
Thank you.